Okay, good evening to one and all. Once again, welcome to our YouTube channel, NANDA Nursing Live. बेटा काली मो पाखु गेस्ट पळे आसिले तो मते सेशन टा एंड करको पड़ला सॉरी बेटा से पई सो और दुटारे भी आसीबार थिला लाइव क्लासेस बट लेट हला बेटा किछि किछि काम थिला मोर काम सरे को पड़ला संडे दिनटा तो दुटारे बस लेट ही गला से 3:30 रे मो आसली लाइव क्लासेस सो फटाफट वीडियो को लाइक कर दियो शेयर कर दियो बेटा मो चैट बॉक्स रे नहीं कि लिंक शेयर कर देछि व्हाट्सएप ग्रुप रो सो व्हाट्सएप ग्रुप रे जॉइन हे जिवो राइट रिक्वेस्ट सेंड करो व्हाट्सएप ग्रुप रे रिक्वेस्ट सेंड कर देले मु अप्रूवल दे देबे बेटा राइट ओके गुड इवनिंग टू वन एंड ऑल वंस अगेन वेलकम बैक टू आवर यूट्यूब चैनल फटाफट वीडियो को लाइक कर दे बेटा एवं शेयर कर दियो समस्त पाक जमते पहुंची पारिबा राइट हमें डिस्कशन करबा मेडिकल सर्जिकल नर्सिंग मोस्ट इंपोर्टेंट एमसीक्यू ओके Last question I'm discussing what legal preparation, question number 334, what legal preparation done for a patient who is undergoing surgery related to fracture? Option A relative present during surgery, option B blood is ready for emergency, option C hospital fee paid, option D sign informed consent, right? So correct answer option D का बेटा नहीं, option D is the correct answer थिला लास्ट एक क्वेश्चन जे हमें पढ़ी थिले हाँ ना नहीं गत काली संध्या रे गुड इवनिंग कुसुम सबर प्रणाम गुड आफ्टरनून गुड इवनिंग ओके मु अप्रूवल दे दोची बेटा जो मैंने एबे देखु छ सेंड रिक्वेस्ट सेंड दे दियो मु अप्रूवल दे दोची हैला ओके करेक्ट आंसर इज ऑप्शन डी राइट जो मैंने रिक्वेस्ट दी छ बेटा अप्रूव कर दी छ मु हैला नेक्स्ट क्वेश्चन which of the following is the center of the sterile field in an operation theater most important MCQ बेटा post anesthetic care unit option में नीचे waiting area option C monitoring devices option D site of the surgical incision which option is the correct answer beta फटाफट आंसर करो which of the following is the center of the sterile field in an operation theater which option is the correct answer beta which option is the correct answer बेटा जो मैंने पर्यंत वीडियो को लाइक करना वीडियो को लाइक कर दे शेयर कर दिया राइट सो करेक्ट आंसर इज ऑप्शन डी साइट ऑफ द सर्जिकल इंसिजन साइट ऑफ द सर्जिकल इंसिजन इज द करेक्ट आंसर दिस इज द सेंटर ऑफ द sterile field in an operation theater right option D is the correct answer next question number 336 which of the following is the correct set of steps in removing sutures which of the following is the correct set of steps in removing suture removing sutures by correct set of steps. Option here, raise the knot with artery forceps and place the tip of the scissor under the knot. Close the skin, gently cut the suture with a scalpel and pull it out with nails. Option B, place the curved tip of the suture scissors on the side close to the skin, raise it, cut abruptly and pull with the forceps. Option C, place the curved tip of the suture scissors directly under the knot or on the side close to the skin, gently cut the suture and pulls it out with the forceps. Option D टा दिसु नाही की. Option D अछि बेटा raise the knot, raise the knot, untie the knot and cover the suture line. Properly question दिसु नाही की बेसी ही जाउछि तो सो पीपीटी रे सब देखिला बेलू असुविधा हो पुणी स्क्रोल हो टेक्स्ट से पे. ओके कोई बात नहीं. ऑप्शन सी हवा करेक्ट आंसर बेटा. प्लेस द कर्व, राइट. ऑप्शन सी इज द करेक्ट आंसर. मु आंसर कहि दोछि बेटा. सो कौन हवा करेक्ट सेट ऑफ स्टेप्स इन रिमूविंग सुचर्स. प्लेस द कर्व्ड टिप ऑफ द सुचर scissors directly under the knot or on the side close to the skin, gently cut the suture and pulls it out with forceps, right. Option C is the correct answer. Place the curved tip of the suture scissors directly under the knot or on the side, next close to the skin, then gently cut the suture and pulls it out with the forceps, right. Option C is the correct set of steps in removing sutures, right. Next question, question number 337. Which of the following number of surgical blade is used? Which of the following number of surgical blade is used for incision and drainage for a wound abscess? Option A 11, option B 17, option C 22, option D 10. So correct answer beta 11 number of scalpel blade, right. 11 नंबर स्कैल्पेल ब्लेड यूज करिकी हमें कौन करछे बेटा सर्जिकल इंसिजन दोजे एंड ड्रेनेज फॉर वुंड एब्सेस करछे, राइट. ऑप्शन ए इज द करेक्ट आंसर, राइट. स्कैल्पेल ब्लेड देखी जाना बेटा ना देखी ना. आइना रोटी मेजर रोटी मन करे इंसिजन पे यूज करा जाए देखी दिबो ना. नेक्स्ट क्वेश्चन बेटा, क्वेश्चन नंबर 338. Which of the following needle type used for fix the surgical drain? Which of the following needle type used for fix the surgical drain? Option A cutting, option B reverse cutting, option C round body, option D taper point. Which option is the correct answer? बेटा फटाफट आंसर कर देलो. Which option is the correct answer? Okay, correct answer is which option बेटा reverse cutting, right. Correct answer is reverse cuttings. Reverse cuttings needle type used for fix the surgical drain. Reverse cutting type needle is used for the fix the surgical drain. Right? Next question. Question number 339. One of the principles of sterile area. Option is prepare before 1 hour or procedure. Option B is sharp end of forceps putting in operate without wearing gloves. Option C is the sterile items keeping 1 centimeter toward inside from corner. Option D is none of the above. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर करो बेटा. So correct answer is option C beta. Option C is the correct answer. The sterile items keeping 1 centimeter toward inside from corner. Right? Next question. What is the value of sodium in half DNS? What is the value of sodium in half DNS? Option A is 0.5%, option B is 0.9%, option C is 0.45%, option D is 1.8%. केते बेटा डेक्सट्रोज नॉर्मल सलाइन रे केते परसेंट रहउची बेटा केते परसेंट रहउची सोडियम आंसर करो फटाफट. Okay, option C is the correct answer. 0.45% रहउची सोडियम. The value of sodium in half DNS. DNS रे केते रहउची बेटा 0.9%. Actually typically DNS रे केते रहे 0.9% हला हाफ DNS रे केते रहइबो बेटा 0.45% हला माने रखि दाओ. Next question number 341. After surgical hand washing the scrub nurse hand should be very important beta. Most important MCQ, 5-star MCQ. Option A is just above the elbow, option B is just below the elbow, option C is just above the waist level, option D is just below the waist level. So which option is the correct answer beta? फटाफट आंसर करो. मैं बोध ये क्वेश्चंस ऑलरेडी डिस्कशन कर सारी छे मोर मन पडुची डिस्कशन कर सारी छे क्वेश्चन फटाफट आंसर करो. Which option is the correct answer? Which option is the correct answer? After surgical hand washing the scrub nurse's hand should be. Option A is just above the elbow, option B is just below the elbow, option C is just above the waist level, option D is just below the waist level. So which option is the correct answer? बेटा आंसर करो ना खाई की ढोळौछ निद लागुची की आंसर करो फटाफट. So correct answer is option A is the correct answer beta is answer. Option A is the correct answer. Just above the elbow, right? Option A is the correct answer. Option A is the correct answer. Next question number 342. Which of these is an open source of which of these is an open source operating system? Computer wala questions. Which of these is an open source operating system? Option A is Unix, option B is Linux, option C is Windows, option D is Mac OS. So correct answer beta Linux. Linux is an operating system open source operating system, right? Next question number 343. What is the role of scrub nurse in an operation theatre? Option A is to assist the surgeon during surgery and set up the sterile table. Option B to respond to request from the surgeon and anesthetist and deliver supplies to the sterile area. Option C to assist anesthetist during surgery. Option D to prepare patient for surgery. What is the role of scrub nurse in an operation theater? Answer करो बेटा. बेटा स्क्रब नर्स रो काम हैला जहाँ रिक्वेस्ट करिवे जहाँ मागिवे ताको हमें रेस्पोंड करिवाटा. सर्जन को असिस्ट करबा पय तांकर थांती टीम थांती बेटा. जहाँ मागिवे हमें ता दउछु ना रेस्पोंड करछे ना. So option B is the correct answer beta, to respond to request from the surgeon and anesthetist to deliver supplies to the sterile area. Scrub nurse, surgical nurse और theater nurse को होचे ना. So option B is the correct answer beta. Option A होबो ना, option B is the correct answer. So हमारा primary role है बेटा हमें respond करे बेटा surgeon को. आमे कौन किसी करि थाउ कि बेटा आमे काटुछु कि ना कौन ये करूछे आमे इंसिजन दउछे ना स्टिचिंग करछे किछि नै बेटा आमे जहाँ से माने मागिबे ताको आमे रेस्पोंड करछे जहाँ कहिबे ता रेस्पोंड करछे माने नै कहिबे शक कहले नै कि शक करा होछि माने नै कटरी दिया गले कटरी दिया होछि इंस्ट्रूमेंट दिया गले इंस्ट्रूमेंट दिया होछि माने नै ब्लीडिंग होतले सक करबा पय को होतबो कि सक्शन मशीन मागुथिबे ए सब जिंस हमें रेस्पोंड करछे आमे किछि एसएस पेसिस्ट करूना बेटा हमें तांगा पकरे छिडा हेतबा आमे भी स्टेराइल गाउन स्टेराइल ग्लोव्स सब पिंदी कि थिबा बेटा स्क्रब नर्स मींस तमे तांगा सहित थिबो टीम रे थिबो हां नै थिएटर नर्स ना सर्जिकल नर्स तांकर टीम पूरा थिबे होल टीम थिबे तांको असिस्ट करबा पय थाते ना असिस्टेंट एसोसिएट एसआर सीनियर रेसिडेंट जूनियर रेसिडेंट तांकर हाउस सर्जन इंटर्न समस्त थांती बट हमर एज ए नर्सिंग ऑफिसर रो जहा काम हैला हम रेस्पोंड करबटा बाकी तक से माने सब करिवे hello option B is the correct answer beta next question question number 344 which gas is commonly used in laparoscopic surgery very very important MCQ laparoscopic surgery जाने छना बेटा without open करके है ना एब्डोमेन ओपन न करके laparoscopic सर्जरी करा हो जाने छना कैमरा थाए laparoscope रे कैमरा थाए कैमरा रो गाइडेड रे ऑपरेशन करा जाए इंटरनल ऑर्गन को विजुअलाइज करिक है ना छोटे छोटे गोटे होल करा हबो एब्डोमेन रे गोटे थाए ओपन एब्डोमेन सर्जरी आ गोटे लैप्रोस्कोपिक सर्जरी थाए है ना जानि छ ना सो को गैस यूज करके लैप्रोस्कोपिक सर्जरी करा जाए N2 ऑप्शन रे N2 ऑप्शन रे CO2 ऑप्शन सी रे O2 ऑप्शन डी रे H2 सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा Which option is the correct answer? फटाफट आंसर कर दिलो सो करेक्ट आंसर है बेटा ऑप्शन बी कार्बन डाइऑक्साइड यूज करे कि ही लैप्रोस्कोपिक सर्जरी करा जाए right? Next question, question number 345. Which is the example of monofilament suture? Which is the example of monofilament suture? Option is silk, option is polydioxynone, option is polyglactin, option is vicryl. Option is silk, option is polydioxynone, option is polyglactin, option D is vicryl. So which option is the correct answer, beta? So correct answer is beta option B, polydioxanone, PDS. PDS. PDS भी कौन है बेटा? Polydioxanone. This is a synthetic absorbable monofilament suture beta. This is a synthetic and absorbable monofilament suture. Monofilament or absorbable monofilament suture, right? Next question, question number 346. Write sequence of WHO surgical safety checklist. Very important. Not set रे भी क्वेश्चन आउछि बेटा हैला हमर OSSC नर्सिंग ऑफिसर एग्जाम रे भी आसी काहे कि ना ओटी मानकर यूज करा होछि बेटा दिस WHO सर्जिकल सेफ्टी चेकलिस्ट जो माने ओटी रे काम करथिबो देखिथिबो मेनली तो ऑप्स गाइनी रो ओजी ओटी रे यूज करा होछि निहाती भाबरे एबे स्टैंडर्ड सर्जिकल सेफ्टी चेकलिस्ट यूज ही जाउछि बेटा ए WHO रो and what is the right sequence of WHO surgical safety checklist? Option is sign in, sign out, time out. Option B is sign out, sign in, time out. Option C is time out, sign out, sign in. Option D is sign in, time out, sign out. So which option is the correct answer? फटाफट आंसर कर दे. Right, option D is the correct answer. Sign in, time out, sign out. Sign in, time out, sign out. Right? Option D is the correct answer. Sign in means beta मैं patient रो identity confirm करूची है ना नहीं correct surgical site जहाँ necessary equipment अच्छी कि नहीं आउ अवेलेबल अच्छी ना नहीं जहाँ सप्लाइज से सब हमें देखुचे साइन इन रे टाइम आउट रे कौन देखुचे बेटा तो इंसिजन दवा पूर्वरु इंसिजन देवा पूर्वरु सर्जिकल टीम रेडी ना नहीं हेलो दैट इज टाइम आउट वर्बली कंफर्म करिवो पेशेंट्स आइडेंटिटी सर्जिकल टीम सहित ए पेशेंट की बोले कि तापर सर्जिकल साइट प्रोसीजर बाकी तक सब जिनस विषय कॉम्प्लिकेशन विषय कौन है पारे सब जिनस रेडी हवार अछि दैट इज द टाइम आउट देन साइन आउट कौन बेटा साइन आउट व्हाट इज साइन आउट साइन आउट मींस आफ्टर सर्जरी बेटा बिफोर सर्जरी सॉरी बिफोर इंसिजन बिफोर सर्जरी को बिफोर इंसिजन साइन आउट मींस आफ्टर द सर्जरी after the surgery right मुझे पढ़ला था sign in means patients confirming the patient's identity, time out before the incision, then sign out after the surgery, right? So option D is the correct answer. Next question, question number 347 sir achi 347 achi damage occurs during direct laryngoscopy. Damage occurs during direct laryngoscopy. Option A gingival laceration, option B damage to mandibular molars, option C damage to maxillary incisors, option D damage to arytenoid cartilage. So which option is the correct answer, beta? So correct answer is option D, damage to arytenoid cartilage. During direct laryngoscopy, damage to the arytenoid cartilage, and this is a pair of pyramid shaped cartilage in the larynx. Pyramid shaped cartilage in the larynx. This is arytenoid cartilage. Arytenoid cartilage is the pyramid shaped cartilage in the larynx. Right? Damage occurs during direct laryngoscope, that is damage to arytenoid cartilage. Right? Next question, question number 348. According to WHO surgical safety checklist, which task should be done before skin incision? Before skin incision. Sign in, sign out, time in, time out. So option D is the correct answer. Option D is the correct answer. According to the WHO surgical safety checklist, before skin incision and during the time out phase. Time out phase. Option D is the correct answer. Time out. Option D is the correct answer. Very very important MCQ माने रखी दो बेटा. Confused हुआ नहीं. हेला माने रखा. एक questions लिखी बजे तो लिखी नहीं जाओ. हेला. So according to WHO surgical safety checklist, which task should be done before skin incision? Time out. Option D is the correct answer. Next question. Question number 349. What is the end product of proteins? Very very important. So what is the end product of proteins? Option A amino acid, option C fructose, option D triglycerides, option D glucose. So which option is the correct answer? Which option is the correct answer? The end product of protein, the end product of protein digestion is amino acids. The end product of protein digestion is amino acids. So option A is the correct answer. Option A is the correct answer. Very good. Very good, Girish Mahapatra, Suchitra, Rima Lakra. Option A is the correct answer. Very good. Question number 350. Vicryl 3.0. Vicryl 3.0 is option A natural absorbable, option B synthetic non-absorbable, option C synthetic absorbable, option D natural non-absorbable. So absorbable suture कौन बेटा? two types रा suture अच्छी, है ना नहीं? Absorbable, non-absorbable, है ना नहीं? हमें देखो चे ना absorbable and non-absorbable, है ना नहीं? Absorbable and non-absorbable, है ना नहीं? So absorbable suture कौन बेटा? Vicryl एबे हमें कथा होतले PDS कथा होतले ना PDS विषय PDS suture polydioxanone PDS डाईऑक्सानो PDS है ना नहीं एंड आउ कौन बेटा विक्रिल PDS एंड मोनोक्राइल these are the observable suture. Non observable suture, nylon, proline and silk, these all are non observable suture, right? So vicryl is synthetic observable suture है ना नहीं vicryl is observable and synthetic suture. So option C is the correct answer beta. So different type of vicryl suture अच्छी बेटा different type of vicryl suture. vicryl suture को एरिया पे हमें यूज करछे बेटा लार्ज इंटेस्टाइन पे यूज करा होची स्मॉल इंटेस्टाइन पे यूज करा होची पेरिटोनियम पे यूज करा होची मसल्स पे यूज करा होची सबक्यूटेनियस टिश्यू पे यूज करा होची स्किन पे यूज करा होची vicryl suture. डिफरेंट टाइप्स ऑफ vicryl suture अछि बेटा 0 साइज अछि 1 साइज अछि 2 साइज अछि बेटा हला 20 साइज अच्छी बेटा देन 30 साइज अच्छी बेटा दिस इज 30 suture 3.1 3.0 नहीं बेटा 30 40 50 60 एंड 70 ए सब suture आउछि बेटा ए टाइप रो suture आउछि vicryl रो आना नहीं. नेक्स्ट क्वेश्चन देखिबा जदि अछि कोन अछि क्वेश्चन 350 मारे फंक्शनल नर्सिंग इज ए मेथड ऑफ प्रोवाइडिंग ऑप्शन अछि केयर ऑफ रेकॉर्ड्स ऑप्शन सी रे अछि पेशेंट केयर ऑप्शन बी रे अछि केस मैनेजमेंट ऑप्शन डी रे अछि बेटा इक्विपमेंट केयर ऑफ रेकॉर्ड्स case management, patient care and equipment care. So which option is the correct answer beta? Functional nursing is a method of providing patient care. Very good Girish Mahapatra, Madhushri Bishwas. Patient care is the correct answer. Patient care अब correct answer है ना नहीं. Next question number 352 बेटा ये important MCQ 5 star MCQ माने रखे था functional nursing important questions बेटा team nursing functional nursing ये सब आसुची बेटा questions right. This is also 5 star MCQ. Next question number 352. Miss Anita asked the nurse when she can start eating after surgery. What is the most appropriate response by the nurse? Miss Anita asked the nurse when she can start eating after surgery. What is the most appropriate response by the nurse? Patient आपण मानकु पचारला कि केते बेले खाइबो से आफ्टर सर्जरी तो आपण मानकर एप्रोप्रिएट रेस्पॉन्स कौन रहिबो सीटा ऑप्शन रे दिया हेछि आपण माने चूज करिवे. ऑप्शन ए अछि टू विल हैव टू आस्क द डॉक्टर. ऑप्शन अछि टेल मी अबाउट योर एपेटाइट. ऑप्शन सी अछि यू विल लाइकली स्टार्ट ऑन क्लियर फीड वंस बाउल साउंड कैन बी हर्ड. ऑप्शन डी अछि आई विल हैव द डाइटिशियन consult with you about the most nutritious post surgery meals. So which option is the correct answer beta? Very good. गिरीश महापात्र ऑप्शन सी, प्रदीप तकोड ऑप्शन सी, मधुश्री विश्वास ऑप्शन सी, सुचित्र ऑप्शन सी, सोनालिका ऑप्शन सी, गिरीश महापात्र, रीमा लाकरा, ज्योतिर्मंजरी ऑप्शन सी. Very good, but option C is the correct answer. Right after surgery, it is important to wait the return of bowel sound, bowel functions before oral intake. है ना? So option C is the correct answer. Next question, question number 353. Gown should be worn when? Gown should be worn when? Option A, the client's hygiene is poor. Option B, the nurse is assisting with medication administration. Option C, the client has acquired immunodeficiency syndrome of hepatitis. Option B, option D, option D, blood of body fluids are likely to get on the nurse's clothing from a task the nurse plans to perform. बेटा which option is the correct answer? फटाफट आंसर कर दिया. एटा पे एम्स नर्सिंग ऑफिसर से एग्जाम रे आसीथिला बेटा. केते बेले गाउन पिंधवा उचित, को केस रे पिंधवा उचित. So correct answer is beta option D is the correct answer. Blood of body fluids are likely to get on the nurse's clothing from a task the nurse plans to perform. Not plans to perform. Plans to perform. Right, option D is the correct answer. But the next question, question number 350. VED stand for, VED stand for बेटा पढ़ी थी भाई क्वेश्चन ए जिंस तो निहाती भाव रे ए एब्रिविएशन तो निहाती भाव रे पढ़ी थी यार फुल फॉर्म कौन VED रो फुल फॉर्म कौन ऑप्शन है वैल्यूएबल एसेंशियल डिजायरेबल 5 स्टार MCQ बेटा बेले बेले ना आशा रो फुल फॉर्म पचारुची VED रो फुल फॉर्म पचारुची WHO रो फुल फॉर्म पचार दे IMNCI रो फुल फॉर्म पचार फुल फॉर्म माने भी हमको माने रखिबार अछि जेमती एग्जामिनेशन पय फुल फॉर्म आसुतला मैक्सिमम फुल फॉर्म तो आसे GNM पिला मानकर एग्जाम रे जो माने GNM कोर्स करिथिबो से माने जानितो तांकर प्रत्येक सब्जेक्ट रे फुल फॉर्म आसे फुल फॉर्म एब्रिविएशन रो फुल फॉर्म गुडा को पचारे थे तो इंपोर्टेंट बेटा बेले बेले क्वेश्चंस आछी. ऑप्शन ए वैल्यूएबल एसेंशियल डिजायरेबल ऑप्शन बी वैल्यूएबल एस्टिमेटेड डिजायरेबल ऑप्शन सी वाइटल एसेंशियल डिजायरेबल ऑप्शन डी वाइटल एस्टिमेटेड डिजायरेबल. सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? सो ऑप्शन सी इज द करेक्ट आंसर बेटा. ऑप्शन सी इज द करेक्ट आंसर. वाइटल एसेंशियल डिजायरेबल, वाइटल एसेंशियल डिजायरेबल. वाइटल तमे सब भूली गलणी पाठ, तमे माने सब भूली गलणी पाठ रे बेटा. VED is used in inventory management. जो मैंने तो BSc नर्सिंग करते बा नर्सिंग मैनेजमेंट एडमिनिस्ट्रेशन मैनेजमेंट रे VED निहाती भाव रे पढ़ी थेबो बेटा किंतु भूली जाइछ त माने मैनेजमेंट पाठ रे पढ़ी थेबा निहाती. VED is used in inventory management, right? Vital, essential or desirable. Next question, question number 355. Normal temperature of operation theater should be maintained between. Normal temperature of operation theater should be maintained between. Very, very important beta. This MCQ is very, very important. Labor room ra temperature, operation theater ra temperature, ये सब questions आसे बेटा. Right, option A रचे 25 to 30 degree Celsius, option B रचे 15 to 20 degree Celsius, option C रचे 18 to 21 degree Celsius, option D रचे 30 to 32 degree Celsius. So which option is the correct answer बेटा? Very good Madhusri Vishwas. The correct answer is option C is the correct answer, 18 to 21 degree Celsius. 18 to 21 degree Celsius. In standard OT guidelines, kete beta kete temperature actually standard OT guidelines recommended temperature beta kete rahiba katha actually 20 degree Celsius plus minus 2 degree Celsius, right? (20 degrees Celsius plus minus 2 degrees Celsius). So option C is the correct answer. But next question number 356. True statement about surgical suture except. True statement about surgical sutures except. Option is vicryl is braided and absorbable suture. Vicryl is braided and absorbable suture. Option B is silk is braided and non-absorbable suture. Option C is monocryl is absorbable suture. Option D is nylon is polypropylene and absorbable suture. So which option is the correct answer beta? Except kachi. True statement about surgical suture except. Who statement ta wrong अछि beta, बाकी तक true. Actually beta nylon is a non-absorbable suture. Non-absorbable suture, not absorbable suture. Nylon is a actually non-absorbable suture. And this is a monofilament suture, non-absorbable and monofilament suture. So option D is the correct answer. Baki tak vicryl is braided and absorbable suture, right? Silk is braided and non-absorbable suture, right? Monocryl is absorbable suture, right? Right? Option D को छाड़ी देले. बाकी तक सब true statement about surgical suture except nylon is polypropylene and absorbable suture को छाड़ दिला, बाकी तक true statement, right? Next question number 357. Which step is not included in WHO surgical checklist? Which step is not included in WHO surgical checklist? फटाफट आंसर करो बेटा, ये सब क्वेश्चंस आसीबो हैला. आउ थरे बेटा मु कहि दोछि, मन रखि दियो नहले लेखि नियो. साइन इन कौन बेटा? बिफोर anesthesia induction. Before anesthesia inductions or administration. Induction or administration, right? Then कौन अच्छे बेटा? Time out. What is time out? Time out beta before skin incision. Before skin incision. लेखी नहीं जाओ बेटा, लेखी नहीं जाओ, right? And sign out कौन है बेटा? Before the patients leaves the operating room, leaves the OT. Sign out before the patient leaves the OT, right? ये हैला सर्जिकल WHO सर्जिकल चेकलिस्ट विषय. सो तीनटा फेज रे काम हुए ओटी रे, साइन इन, टाइम आउट एंड साइन आउट. सो कोटा हमर सर्जिकल चेकलिस्ट रे रहू नाही, सीटा हैला टाइम इन. बुझी पारलो? टाइम इन मने रख, कंफ्यूजन हबनी. वेरी वेरी इंपोर्टेंट 5 स्टार MCQ. नेक्स्ट क्वेश्चन, ए MCQ नॉर्सेट रे भी आसुची बेटा, मने रख जो मैंने नर्सेट दोच जो मैंने OSSC नर्सिंग ऑफिसर एग्जाम दोच मने रखबार अछि उभय एग्जाम राइट Which of the following is not a responsibility of scrub nurse? Which of the following is not a responsibility of scrub nurse? Option A is prepare operating trolley. Option B is assist surgery. Option C is apply dressing and bandage after completion of surgery. Option D is taking treatment order from ward nurse. Answer करो बेटा. So correct answer is option D beta. Taking treatment order from ward nurse. This is not the responsibility for scrub nurse. Next question. Question number 359. Which of the following is not a variety of absorbable suture? Which of the following is not a variety of absorbable suture? Option A is polyglyctin. Option B is polyglycolic acid. Option C is polydioxanone. Option D is polyamide. Polyamide. So which option is the correct answer beta? Not a variety of absorbable suture. So polyglyctin is a absorbable suture, right? This is a absorbable suture. Polyglycolic acid, this is also absorbable suture. Polydioxanone, this is PDS. PDS also a absorbable suture. But polyamide is not a absorbable suture, right? This is polyamide or nylon कहते बेटा polyamide को nylon suture. This is non-absorbable suture, right? Non-absorbable suture. Option D is the correct answer beta. Next question. Question number 360. All of the following are included in surgical safety checklist except. All of the following are included in surgical safety checklist except. Option A is name of the surgeon and anesthetist. Option B is confirm the patient name and procedure. Option C is confirm the specimen labeling for transport the biopsy. Option D is confirm the patient blood group. So which option is the correct answer? All of the following are included in surgical safety checklist except को जिनसटा को छाड़ी देले बाकी सबू सर्जिकल सेफ्टी चेकलिस्ट इंक्लूड अंतर्भुक्त अछि. Very good. Option A is the correct answer. Option A is the correct answer. The name of the surgeon and anesthetist. Option A is the correct answer. Next question. Question number 361. The following statement are true regarding operating system except. पुणे आसीगला कंप्यूटर क्वेश्चंस गुटे include हिजेछि हो किछि कथा नै. Option A is NOS coordinated activities of various parts of computer. Option B is it optimizes the uses of the resources of a computer. Option C is it is essential for a computer to switch on. Option D is it helps in retrieving data. So correct answer is option B beta. Option B is the correct answer. Except it optimizes the uses of the resource of computer chhade ke baki all are the statements, true statements regarding operating system. So option B is the correct answer. Option B is the correct answer. But next question, question number 362. The following are the important pre-operating nursing care for a patient with benign prostatic hypertrophy, BPH. BPH पढ़ी थी ना बेटा मेडिकल सर्जिकल नर्सिंग रे पढ़ी थी निहाती भाव रे. The following are the important pre-operative nursing care for a patient with benign prostatic hypertrophy BPH except. Option A is assure nutrition and correct fluid and electrolyte balance. Option B is promoting urinary drainage. Option C is hormonal therapy. Option D is acid diet to treat infections. So which option is the correct answer? Which option is the correct answer? So correct answer is beta option C, except hormonal therapy. So assure nutrition and correct food and electrolyte balance. This is the most important operative nursing care. Promoting urinary drainage. This is also most important pre-operative nursing care for the patient of BPH. Acid as diet to treat infection. This is also most important pre-operative nursing care for the BPH patients. Right? Except hormonal therapy. Option C is the correct answer. Next question. Which of the following is a standardized scale that can be used by a nurse to best quantify the severity of post-operative pain in an adult patient? Which of the following is a standardized scale that can be used by a nurse to best quantify the severity of post-operative pain in an adult patient? Pain in an adult patient. Standardized scale for post-operative pain in an adult patient. Option is color analog scale. Option is 11-point numerical rating scale. Option is descriptive rating scale. Option is faces pain scale. So which option is the correct answer? Beta, which option is the correct answer? So correct answer is a numerical rating scale, NRS. NRS. NRS, numerical rating scale. माने अच्छी बेटा numerical rating scale. This is the standardized scale used for severity quantify the severity of post-operative pain in adult patients. 11-point numerical rating scale. Option B is the correct answer, right? Option B is the correct answer. Next question, beta. Question number 364. Which of the following is a major complication following surgery? Which of the following is a major complications? Which of the following is a major complications following surgery? Which of the following is a major complication following surgery? Option A is increased lung expansion. Option B is atelectasis. Option C is increased oxygen saturation levels. Option D is decreased lung expansion. So correct answer is decreased lung expansion. Beta. Option D is the correct answer. This is a major complications surgery. This is a major complications surgery. Right? Option D is the correct answer. So complication after surgery, major complications after surgery, decreased lung expansion. है ना बेटा? Decreased lung expansion. Next question, question number 365. EMLA. EMLA. कौन है बेटा EMLA? EMLA. EMLA कौन? Eutectic. like a eutectic mixture of local anesthetics. That is EMLA, eutectic mixture of local anesthetics, a topical anesthetics, or this is a cream beta, right? Should be EMLA topical anesthetics or EMLA is a cream should be applied for how much time before the procedure? EMLA cream or topical anesthetics should be applied for how much time before the procedure? Option is 10 minutes. Option B is 30 minutes. Option C is 60 minutes. Option D is immediately before procedure. So which option is the correct answer? So correct answer is beta option C, 60 minutes before procedure आमे apply करिबा EMLA cream. EMLA cream or topical anesthetics. EMLA cream should be applied at least 60 minutes before the procedure. 60 minutes before the procedure. Next question, question number 366. बेटा माने रखे तो important है. एक भी मु 5 स्टार दे दूँ माने रखे तो. ये तो लोग questions पचारे दबा nurse set जो मैंने nurse set exam दो तो. Right. Next question, question number 366. All of the following options are true related to bed sore except. All of the following options are true related to bed sore except. Option A early bed sore can treat with care. Option B most common site for bed sore it's sacrum. Option C air mattress cannot reduce the chance of bed sore. Option D change the client position every 2 hours. So which of the following options are true related to bed sore? Answer करो बेटा, answer करो. बढ़िया बढ़िया questions, very very important MCQ related to bed sore. Early bed sore can treat with care. This is true related about bed sore. है ना? Most common site for bed sore is sacrum. This is related to true related to bed sore, right? Air mattress cannot reduce the chance of bed sore. This is wrong. This is wrong, beta. Air mattress actually helps to reduce the chance of developing bed sores. है ना नहीं? Actually reduce the chance of bed sore. Cannot लेकिन this is wrong. Air mattress actually reduce the chance of bed sore. Option D change the client position every 2 hours. Right, this is true related to bed sore. So option C is the correct answer. But option C is the correct answer. Next question, question number 367. Purpose behind using the stocking following abdominal surgery. Abdominal surgery related questions. Purpose behind using the stocking following abdominal surgery. Option A to prevent atelectasis. Option B to prevent DVT. Option C to prevent dehydration. Option D to prevent negative nitrogen balance. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दे बेटा. आंसर कर दियो फटाफट. आंसर करो फटाफट. स्टॉकिंग्स यूज करा जाए ना बेटा को केस रे डीप वेन थ्रोम्बोसिस केस रे यूज करा जाए ना बेटा स्टॉकिंग्स so blood cut forms in a deep vein most commonly in the legs after major surgery like abdominal surgery. Oh no नहीं बेटा. So option B is the correct answer बेटा. Stockings लगा हुए जाने चना to prevent DVT abdominal surgery परे नहीं कि बेटा. Stockings लगा हुए. Option B is the correct answer बेटा. DVT deep vein thrombosis. Deep vein thrombosis. Next question, question number 368. Why patients are kept NPO and fluid administered intravenously before the surgery? Very, very tricky questions. Why patients are kept in nil for oral and fluid administered intravenously before the surgery? Answer करो बेटा फटाफट. Question रहला तम मानक मोबाइल स्क्रीन रे. Option A for successful of surgery. Option B to prevent dehydration. Option C to prevent aspiration and maintain adequate fluid and electrolyte balance. Option D for better absorption of medication. Surgery पूर्वरु intravenously फ्लूइड दिया हुए एंड पेशेंट को एनपीओ रखा हुए कौन पाए व्हाई पेशेंट आर केप्ट एनपीओ एंड फ्लूइड एडमिनिस्टर इंट्रावेनसली बिफोर द सर्जरी सर्जरी पूर्व कौन पाए पेशेंट को एनपीओ रखा हुए एवं इंट्रावेनसली फ्लूइड दिया हुए एडमिनिस्टर करा हुए सो व्हिच ऑप्शन इज द करेक्ट आंसर कौन सा आंसर सही होगा कौन सा ऑप्शन सही होगा बेटा जी बोल दो right to prevent aspiration to maintain adequate fluid and electrolyte balance so option C is the correct answer Amit M2 कौन है M2B bloggers अच्छा M2B bloggers option C is the correct answer Kusum Savar Sakuntala Padan option C जाग्ञाशिनी तांडी गीतांजलि बेहरा उर्मिला पृष्टि वेरी गुड रीमा लाकरा ज्योति मंजर वेरी गुड गुड आंसर बहुत बढ़िया गुड आंसर समझते ठीक ठाक आंसर कर बेटा जो मैंने व्हाट्सएप ग्रुप रे जॉइन है ना व्हाट्सएप ग्रुप रे जॉइन है जीवा राइट मो लिंक शेयर कर दीची आउ थरे लिंक शेयर कर दूची जो मैंने पर्यंत जॉइन है ना जॉइन है जाओ राइट तो करेक्ट आंसर कौन ऑप्शन सी इज द करेक्ट आंसर बेटा राइट ऑप्शन सी इज द करेक्ट आंसर राइट नेक्स्ट क्वेश्चन बेटा क्वेश्चन नंबर 369 अछि इन अ फीमेल पेशेंट मॉडिफाइड इन अ फीमेल पेशेंट मॉडिफाइड बेटा मो लिंक शेयर कर दिले बेटा जॉइन है जो मैंने जॉइन हवा पई चाहो छो एंड इंफॉर्मेशन जानवा पई पहुंच चाहो छो से मैंने जॉइन है जो ग्रुप राइट शेयर कर दीजिए लिंक रे जॉइन है इन a female patient modified radical mastectomy has been done which of the following organs can be removed in this type of surgery option is areola option is nipple option is breast tissue option is all of the above so which option is the correct answer beta which option is the correct answer फटाफट आंसर कर दिया which option is the correct answer तो ऑप्शन डी इज द करेक्ट आंसर ऑल ऑफ द अबव हवा बेटा एरियोला भी हवा निपल भी हवा ब्रेस्ट टिश्यू भी हवा in a female patient modified radical mastectomy has been done so all of the organ can be removed in this type of surgery right areola nipple breast tissue all of the above so option D is the correct answer option D is the correct answer next question question number 370 one post operative patient having a surgical drain cleaning direction of the drain side should very important beta cleaning direction of the drain site केमती आमे क्लीनिंग करबा ड्रेन साइट रे ऑप्शन रचे इनर टू आउटर इन सर्कुलर डायरेक्शन ऑप्शन बी रचे आउटर टू इनर इन सर्कुलर डायरेक्शन ऑप्शन सी रचे फ्रॉम अपर टू लोअर साइड ऑप्शन डी रचे सर्कुलर आउटर टू सेंटर सो व्हिच ऑप्शन इज द करेक्ट आंसर फटाफट आंसर कर दिया बेटा व्हिच ऑप्शन इज द करेक्ट आंसर व्हिच ऑप्शन इज द करेक्ट आंसर फटाफट वेरी इंपॉर्टेंट क्वेश्चंस बेटा post-operative patient having a surgical drain cleaning direction of the drain side should inner to outer in circular direction option A is the correct answer option A is the correct answer Girish Mahapatra Pradeep Goda Bubu Behera very good M2B vloggers very good option A is the correct answer next question question number 371 the priority nursing interventions for a patient during the immediate post-operative period is the priority nursing intervention for a patient during the immediate post-operative period is option is observing for hemorrhage, option B is maintain a patient airway, option C is checking the vital parameters every 15 minutes, option D is check the level of consciousness. So which option is the correct answer beta? Which option is the correct answer? So correct answer is maintain a patent airway. Maintain a patent airway. The priority nursing interventions for a patient during immediate post-operative period is to maintain a patent airway. Option B is the correct answer. Option B is the correct answer. Next question, question number 372. What is the responsibility of nursing officers before surgery? What is the responsibility of nursing officers before surgery? What is the responsibility of nursing officers before surgery? Option A is explain the risk of surgery. Option B is explain the procedure and inform consent. Option C is to mentally prepare the patient for surgery. Option D is explain the consequence of the surgery. So which option is the correct answer beta? Which option is the correct answer? Right, option C is the correct answer. To mentally prepare the patient for surgery. Option C is the correct answer. This is the responsibility of nursing officers before surgery. Mentally preparing the patient for surgery, helping the patient feel calm and comfortable by doing so. Right, option C is the correct answer. Option C is the correct answer, right? And nursing officers play an important role for patients' emotional and psychological well-being before surgery. Right? Next question, question number 373. Which gas filled image dabar thila image ta oh yaine kichu katha na which gas filled in this blue color coded vaporizer in anesthesia machine? Option A rachi sevoflurane isoflurane, option B rachi isofurane, option C rachi halothane, option D rachi desflurane. So correct answer is beta desflurane, right? Desflurane gas filled in the blue color coded vaporizer, right? In anesthesia machine. Option D is the correct answer. Gitanjali Behra, very good. Option D is the correct answer. Next question, question number 374. Before operation, purpose of neomycin administration. Before operations, purpose of neomycin administration. Option A prevent post-operative infections. Option B decrease bacterial growth in pre-operative period. Option C is prevent constipation. Option D is prevent gas formation. So which option is the correct answer? So correct answer is beta option A, prevent post-operative infections. So before operation, purpose of neomycin administration is prevent post-operative infections. Option A is the correct answer. Next question, question number 375. During ongoing surgery under general anesthesia, which parameter is the first priority? During ongoing surgery under general anesthesia, which parameter is the first priority? Option A is ABG, option B is vital sign including oxygen saturation with pulse oximeter, option C is reflexes, option D is urine output. So which option is the correct answer beta? Which option is the correct answer? During ongoing surgery under general anesthesia, which parameter is the first priority? Which parameter is the first priority? Answer karo beta. ABG analysis or vital sign including oxygen saturation with pulse oximeter. Option C rachi reflexes, option D rachi urine output. अरे बेटा ड्यूरिंग ऑनगोइंग सर्जरी गिरीश महापात्र अरे यार कुछ तो समझो बेटा लिखा है ड्यूरिंग ऑनगोइंग सर्जरी रे तुम रिफ्लेक्सेस चेक करिवो कि which parameter is the first priority? जनरल एनेस्थेसिया रे अछि बेटा कोन रिफ्लेक्सेस पाइबो तमे पेशेंट तो पूरा कोमा रे थिबो पेशेंट को जणा भी पड़िबोनी तार अंग प्रत्यंग ऑर्गन काढी निकरी गले भी कुआडे तमरा रिफ्लेक्सेस पाइबो बेटा तुम ना मार खाएगा गिरीश महापात्र दौड़ा दौड़ा के मारेंगे तुमको माड़ो दरकार वाइटल साइंस होबो ना वाइटल साइन इंक्लूडिंग ऑक्सीजन सैचुरेशन पल्स ऑक्सीमीटर पेशेंट टाकी होची कि पेशेंट ब्लड प्रेशर बढ़ुची कमुची टाकी काडिया होची ब्राडी काडिया होची कि ऑक्सीजन सैचुरेशन फॉल होची ना बढ़ुची कौन होची कि ठीक ठाक अछि सब मॉनिटर करबा छे दिस इज द फर्स्ट प्रायोरिटी बेटा वाइटल साइंस देखुथांती मॉनिटरिंग करंती पेशेंट जति जनरल एनेस्थेसिया रे अछि पेशेंट आरएस जाउची कि कौन होची सब पैरामीटर्स चेक होता है मॉनिटर रे ना यूरिन आउटपुट चेक करिवो यूरिन आउटपुट पोस्ट ऑपरेटिवली बेटा परे यूरिन आउटपुट चेक करा जाय 24 आवर भीतर यूरिन आउटपुट केते हला देखा जाय सर्जरी पेशेंट रिफ्लेक्सेस परे ऑपरेशन परे आसीबो बेटा पोस्ट ऑपरेटिव एबीजी एनालिसिस भी पोस्ट ऑपरेटिवली हम देखु छे गोटे दिन परे यदि पेशेंट वेंटिलेटर को पळेला एबीजी एनालिसिस करा होछ राइट ऑप्शन बी इज द करेक्ट आंसर राइट during ongoing surgery under general anesthesia which parameter is the first priority that is vital signs including oxygen saturation with pulse oximeter next question number 376 which medication given to a patient in pre-operative period to reduce infections which medication given to a patient in pre-operative period to reduce infections option A is antihypertensive option B is antibiotics option C is antitussive and option D is antifungal so which option is the correct answer which option is the correct answer so correct answer is beta antibiotic very good antibiotic is the correct answer next question number 377 according to WHO surgical site infections consider after how many days of surgery most important MCQ very important on rakha beta very important MCQ नॉरसेट पाई भी और OSSC नर्सिंग ऑफिसर एग्जाम पाई भी according to WHO surgical site infections consider after how many days of surgery within 20 days option B within 14 days option C within 7 days option D within 45 days so correct answer is which option beta so option A is the correct answer 90 days very good Devabrata Raut Shipu with implant 90 days 30 or 90 beta 30 or 90 right this is important but ama pakare within 28 days achi beta option A is the correct answer habo 30 or 90 with implant 90 days very good Shipu without implant beta 30 days with implant 90 days खाली सर्जरी दे हेतिबा 30 days right so option A is the correct answer option A is the correct answer depending on surgical procedure beta 30 or 90 days right so option A is the correct answer thank you beta thank you Devabrata Raut very good god bless you next question number 378 a patient is brought in the ward after stomach surgery. A patient is brought in the ward after stomach surgery after 24 hours. What will expect color of stomach suction content? A patient is brought in the ward after stomach surgery after 24 hours. What will expect color of stomach suction content? What will expect color of stomach suction content. Option A is bright red, option B is pale yellow color, option C is brown to black with clot, option D is cirrus color. So which option is the correct answer? Which option is the correct answer? बेटा सीरियस कलर आइबा हला सीरियस कलर आसीबा यदि ब्राइट रेड आसीबा नै पेशेंट डेंजरस कंडीशन असुविधा हबो देन दिस इज डेंजरस कंडीशन फ्रेश ब्लीडिंग जदि होतो होला ब्राइट रेड ना फ्रेश ब्लीडिंग 24 आवर आफ्टर 24 आवर लिखिछि बेटा आफ्टर 24 आवर केबे भी फ्रेश ब्लीडिंग आसीबानी अन नाई बकी जीआई ब्लीडिंग होतले बेटा ब्राउन टू ब्लैक विथ क्लॉट हबो जीआई ब्लीडिंग होतले गैस्ट्रोइंटेस्टिनल ब्लीडिंग जदि होतबो कॉफी कॉफी कलर ब्राउन टू ब्लैक विथ क्लॉट आसबे जीआई ब्लीडिंग होतो है ना नहीं पेल येलो कलर gastric suction after stomach surgery. This is not the color coding of stomach suction contents expected after 24 hour. This is the intestinal content beta intestinal content of intestinal content or bile content, right? Pale yellow color. So correct answer is option D है beta. Option D is the correct answer. Cirrus color asiba beta after 24 hour we expect color of stomach suction content, right? Next question, question number 379. Early sign of increased ICP, very important, very important. In early sign of increased ICP, option A alter eloquy, loss of consciousness, option B vomiting, option C papilledema, option D hypertension. So correct answer is beta altered LOC, loss of consciousness, LOC, loss of consciousness. Increased होती है ICP बेटा patient confused drowsiness रोची so loss of consciousness अब बेटा चला option A is the correct answer. Next question, question number 380. A patient posted of surgery advised to remove jewelry. A patient posted of surgery advised to remove jewelry because option A to maintain or ethics, option B it causes burn to patient with use of cutlery, option C to prevent theft, option D to prevent disturbance to surgeon. So which option is the correct answer? Which option is the correct answer? So correct answer is it causes burns to patient with use of cutlery. A patient posted of surgery advised to remove jewelry because it causes burn to patient with cutlery. Right? Option B is the correct answer. But next question, question number 381. Why is it necessary to remove dark color nail paint before surgery? Why is it remove? Very important beta. Very important. कौन पाई हमें nail color, nail paint और nail polish को हमको remove करवा पाई हमें कहूँ before surgery. Option A nail paint interfere with SpO2 monitoring and we cannot assess capillary refill time, CRT, capillary refill time. Option B to prevent burns from cutlery. Option C nail paint increases chance of infections. Option D to follow OT ethics. So which option is the correct answer? Nursery questions beta AIIMS nursing officers exam questions. So which option is the correct answer? Which option is the correct answer? Very good. Option A only correct answer. But option A is the correct answer. Very good. Nail paint interfere with saturations or SpO2 monitoring, and we cannot assess capillary refill time, CRT. Very good, very good, very good, बहुत बढ़िया. Cannot assess CRT. Very good beta. Next questions. 382. Wilson disease in associated with. Wilson's disease is associated with. Option A is amylase. Option B is creatine kinase. Option C is ceruloplasmin. Option D is lipase. So which option is the correct answer? Wilson disease in associated with. Wilson disease good hereditary conditions beta. It causes increased levels of coppers in several organs like liver, brains and eyes रे beta. ला हेले हमें Wilson disease होचे हमन को right. इते बेले increased levels of coppers in several organs like liver, brain and eyes. पहले Wilson disease होचे. So most of people diagnosed with Wilson disease at the age of 5 and 35, right? 5 and 35 age re diagnose ही थांती बेटा Wilson disease रे. So correct answer have बेटा option C is the correct answer. Ceruloplasmin. This is a protein and liver makes that the helps transport copper throughout the body, right? So option C is the correct answer, right? So liver कौन करुची बेटा helps to transport copper throughout the body. So option C is the correct answer. Wilson disease in associated with ceruloplasmin. This is a protein beta, right? Next question, question number 383. pH is the negative pH is the negative logarithm of the concentration of option A calcium ions, option B magnesium ions, option C potassium ions, option D hydrogen ions. So which option is the correct answer beta? Which option is the correct answer? pH is the negative logarithm of the concentration of hydrogen ion beta. Option D is the correct answer. Hydrogen ion, right? Option D is the correct answer. Next question, question number 384. Preparing the patient both physically and psychologically is done during the dash period. Option A is perioperative, sorry, preoperative. Option B is intraoperative. Option C is incubation. Option D is post-operative. Answer करो बेटा फटाफट. Most important MCQ. Preparing the patient with both physically and psychologically is done during the dash period. Answer कर दियो. गिरीश महापात्र. ऑप्शन ए सोनालिका. ऑप्शन ए देवव्रत राउत. ऑप्शन ए शरत. ऑप्शन ए सौम्य पाणिग्राही. ऑप्शन ए यशो यशोनानी. ऑप्शन ए Pradipta Gold. Option is Shakuntala Padhan. Option A. Very good beta. Option A is the correct answer only, right? Preoperative time रे हमें patient को prepare करूचे physically and psychologically. हाँ ना नहीं? Preoperative क्या रहे patient को हमें prepare करूचे physically and psychologically, right? Preparing a patient physically and psychologically is done during the preoperative period. Right? Next question, question number 385. Which one of the following is a method for effective control of pain in post-operative patient and those with chronic pain? Which one of the following is a method for effective control of pain in post-operative patient and those with chronic pain? Option is parenteral route. Option B is transmucosal route. Option C is intraspinal route. Option D is transdermal route. So which option is the correct answer? बेटा फटाफट आंसर कर देला. Which option is the correct answer? Okay, beta. Which option is the correct answer? Option D is the correct answer, but option D is the correct answer. Transdermal. Transdermal route. This method for effective control of pain in post-operative patient and those with chronic pain. Transdermal drug administration केमती एब्जॉर्ब हुए थ्रू द स्किन हुए बेटा ट्रांसडर्मल रूट दैट इज एब्जॉर्ब्ड थ्रू स्किन ट्रांसडर्मल रूट ऑफ एडमिनिस्ट्रेशन थ्रू द स्किन ना बेटा एग्जाम्पल देवी बेटा किसी एग्जाम्पल देवी निकोटिन पैचेस किछि किछि पैचेस देला पर स्किन रे से माने काम करंती पेन किलर्स भलिया बुझछ ना नहीं पैचेस दैट कंटेन्स पेन किलर पैचेस that contain painkiller. Hello. So option D is the correct answer, beta. Next question, question number 386. The drug bupivacaine is used for. The drug bupivacaine is used for option A nerve block, option B muscles block, option C blood block, and option D CSF block. And bupivacaine is a local anesthetics, local anesthesia. Local anesthesia, right? So local anesthesia माध्यम रे हमें कौन ब्लॉक करछे बेटा obviously nerve block. Option A is the correct answer. Option A is the correct answer. Next question, question number 387. In a teaching session about post-operative pain management, a nurse educator should discuss. In a teaching session about post-operative patient management, a nurse educator should discuss. Option A is the need to use pain medication only when absolutely necessary. Option B is the pain medication will be ordered according to the patient need. Option C is how the method of pain medication administration can be altered after surgery. Option D is the use of patient control device that will deliver medication to the patient. So which option is the correct answer? Which option is the correct answer? So correct answer is beta option D, right? Option D is the correct answer. In a teaching session about post-operative pain management, a nurse educator should discuss about the use of patient control devices. The use of patient control devices that will deliver medication to the patient. Patient control devices. PCA. Patient control analgesia. The patient control analgesia. PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control devices, or that is PCA. The use of patient control devices, or that is PCA, patient control analgesia. PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analgesia, PCA. The use of patient control devices, or that is PCA, patient control analge devices. Patient control analgesia devices. It will deliver medication to the patients. Patient control analgesia devices beta. PCA device. The use of patient controlled analgesia device that will deliver medication to the patient. Option D is the correct answer. Next question, question number 388. A nurse for a patient subjected to total laryngectomy. A nurse for patient subjected to total laryngectomy should plan for option A keeping tracheostomy cough fully inflated. Option B is oral feeds at intervals. Option C is alternative communications method. Option D is supine position for patients. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is beta option C is the correct answer. Alternative communication method. Right? A total laryngectomy involves a complete removal of the larynx. Complete removal of the total laryngectomy means complete removal of larynx. Removal of larynx, right? So this organ is responsible for. So larynx is responsible for what? Beta voice production. Voice production. Larynx is responsible for voice productions. हाँ ना नहीं? हाँ कि नहीं बेटा? So patient जदि हमें total remove कर देबा कि complete remove कर देबा ताहले से कही पारिबनी. So communication रो alternative method टा use करिबा को पड़िबो बेटा. Alternative method use करिबा को पड़िबो. हाँ ना नहीं? Right, voice box or voice production. Larynx is responsible for voice productions. हाँ ना नहीं? So जेहेतु completely remove कर दिया है ची ताहले patient now unable to speak. Patient कथा वार्ता करी पारे बनी तो so कथा वार्ता रो तर alternative methods communication method रो alternative ता पाई alternative communication method टा use करा हबो ई केस रे पर total laryngectomy patient सहित. Option C is the correct answer. Next question, question number 389. Which of these parameters indicates infections in a post-operative patients? Which of these parameters indicates infections in a post-operative patients? Option A is white blood count of 6,000 cells per cubic millimeters. Option B is presence of an indwelling urinary catheter. Option C is rectal temperature of 37.8 degrees Celsius. Option D is red, warm and tender incision site. So which option is the correct answer, beta? Which of these parameters indicates infection in a post-operative patients? आंसर कर लो, फटाफट आंसर करो. Very good Girish Mahapatra Devrat Raut. Pradeep to good. Option D only correct answer. Red, warm and tender incision site. Option D is the correct answer. Very good. Next question. Question number 390. How a nurse assesses the proper functioning of laryngeal nerve after thyroidectomy? Option A tail to speak words. Option B throat swabs for age reflex. Option C provide oral fluids. Option D check motor response. So which option is the correct answer? फटाफट आंसर कर दो. How a nurse assesses the proper functioning of laryngeal nerve after thyroidectomy? So correct answer is option A. Tell to speak words. Tell to speak words. Right, option A is the correct answer. Next question, question number 391. What is the priority nursing interventions in post-operative or for a patient with thyroidectomy? Option A is AROA, option B is bleeding, option C is LOC, option D is ambulation. So which option is the correct answer? Which option is the correct answer? What is the priority nursing intervention in post-operative or for a patient with thyroidectomy? AROA, bleeding, LOC, ambulation. So correct answer is option A, AROA. Option A is the correct answer. But option A is the correct answer. Next question, question number 392. Very good. Next question, question number 392. Why a drainage tube is kept for a patient after post-operative surgery? Option A, to help the bacteria to escape from the site. Option B, to give a decayed space for reconstructive surgery site. Option C, to drain the fluids and blood from the operative site. Option D, to get sample from drainage tube for laboratory purpose. So correct answer is option C, to drain the fluids and blood from the operative side. Right? A surgical drain placed near the surgical incision to remove excess fluid like blood, serum and pus from the wound area. So to drain the fluids and blood from the operative side. Drainage tube is kept for a patient after post-operative surgery. Drainage tube to drain the fluids and blood from the operative sites, right? Option C is the correct answer. Next question, question number 393. Most common complications of respiratory systems. Most common complication of respiratory system following abdominal surgery. Option A, pneumonia. Option B, atelectasis. Option C, emphysema. Option D, bronchitis. So which option is the correct answer? Which option is the correct answer? Fatafat answer karo. Which option is the correct answer? Which option is the correct answer? So correct answer is option B is the correct answer. Atelectasis. Atelectasis or lungs collapse is the most common respiratory systems complications. This is the most common complication of a respiratory system lung collapse or atelectasis after abdominal surgery. Next question, question number 394. Mark the incorrect potential post-operative complications. Mark the incorrect potential post-operative complications of their respective body system. Option A, respiratory system, atelectasis, pulmonary embolism. Option B, circulatory, deep vein thrombosis, pulmonary embolism. Option C, cardiovascular, thrombophlebitis, stroke. Option D, neurologic, weakness, fatigue, breakdown. So which option is the correct answer, beta? Respiratory system atelectasis, pulmonary embolism. Options B, circulatory, deep vein thrombosis, pulmonary embolism. Cardiovascular thrombophlebitis, stroke. Option D, neurologic, related to weakness, fatigue, breakdown. So which option is the correct answer? So respiratory system atelectasis, pulmonary embolism, this is the correct complications of post-operative. Then circulatory, this is also correct statement. Potential post-operative complications. And cardiovascular, this is also correct potential of post-operative complications, right? But option D is the incorrect potential post-operative complications, right? Option D is the correct answer. Option D is the correct answer. Next question, question number 395. Which one of the following is not a type of regional anesthesia? Which one of the following is not a type of regional anesthesia? ऑप्शन रही जनरल एनेस्थेसिया, ऑप्शन रही नर्व ब्लॉक, ऑप्शन सी रही एपिड्यूरल एनेस्थेसिया, ऑप्शन रही स्पाइनल एनेस्थेसिया। सो रीजनल एनेस्थेसिया तो जनरल एनेस्थेसिया हुआ बेटा, ऑप्शन ए इज द करेक्ट आंसर। जनरल एनेस्थेसिया इज नॉट ए रीजनल एनेस्थेसिया और लोकल एनेस्थेसिया। रीजनल एनेस्थेसिया को लोकल एनेस्थेसिया भी कहा जाए बेटा, लोकल एनेस्थेसिया। बुझी पारला, रीजनल एनेस्थेसिया और लोकल एनेस्थेसिया। So general anesthesia is not a regional anesthesia or local anesthesia. Right, option A is the correct answer. Very good. Pradipta Goda, Girish Mahapatra. Very good, beta. Next question, question number 396. A patient is scheduled for elective surgery before 1 day of surgery. What is the important nursing responsibility 1 day prior to elective surgery? Except option is PAC check, pre-anesthetic checkup, option B teaching, option C consent, option D rehabilitation. So which option is the correct answer? A patient is scheduled for elective surgery before 1 day of surgery. What is the important nursing responsibility 1 day prior to elective surgery? Except PAC checkup हुए बेटा, प्री एनेस्थेटिक चेकअप हुए ना नहीं हुए, टीचिंग करिवा पेशेंट को रिगार्डिंग ऑपरेशंस हाँ ना नहीं, काउंसलिंग करिवा, टीचिंग करिवा, कंसेंट मध्य नब हाँ ना नहीं। सो रिहैबिलिटेशन को छाड़ी कि बाकी तक आमे इलेक्टिव सर्जरी रा बिफोर 1 डे रु आमे तांको ई सब जिंस कराउछि हाँ ना नहीं, कंसेंट नउछि, टीचिंग अबाउट सर्जरी and PAC checkup, pre-anesthetic checkups courses. So option D is the correct answer. Very good. Girish Mahapatra, Gitanjali Behera, Bubu Behera, Pradeep Tagoda, Babita Tande, Shomya, Devabrata, Gayatri Shwai. Very good. Option D only correct answer. Very good. Next question, question number 397. Which of the following is not a sign of respiratory distress in a newborn? Which of the following is not a sign of respiratory distress in a newborn? Option A cyanosis, option B expiratory grunting, option C sternal retractions, option D respiratory rate varying according to the newborn's activity. Which of the following is not a sign of respiratory distress in newborn? So which option is the correct answer? Which option is the correct answer? So cyanosis is a sign of respiratory distress. Expiratory grunting, this is also a respiratory distress sign of a newborn. External retraction, this is also a sign of respiratory distress in newborn, but respiratory rate varying according to the newborn's activity. Option D is not a sign of respiratory distress in a newborn, right? Option D is the correct answer. So respiratory rate varying according to the newborn's activity. Newborn's activity कौन कौन है ते पर? In crying, in sleeping, crying, sleeping, and feeding. ये सब होगा बेटा? होगा नहीं ना? This is not a sign of respiratory distress in a newborn, right? Option D is the correct answer. Next question, question number 398. Which of the following diseases are commonly referred as blue bloaters and pink puffers? Which of the following diseases are commonly referred as blue bloaters and pink puffers? Blue bloaters and pink puffers. Option A blue bloaters, that is chronic bronchitis, pink buffer, that is emphysema. Option B blue bloaters, that is emphysema, pink puffers, that is chronic bronchitis. Option C blue bloaters, that is pneumonia, pink puffers, that is
pulmonary tuberculosis. Then option D rachi blue bloaters, that is pulmonary tuberculosis, and pink puffers, that is pneumonia. So which option is the correct answer? So which option is the correct answer? Most interesting questions beta. And this is the conditions of beta COPD. So blue bloaters refers to chronic bronchitis, and pink puffers refers to emphysema, right? So option A is the correct answer. But option A is the correct answer. Very good, very good. Option A is the correct answer. Very good, Girish. Very good, very good. Devavrata, Gitanjali, Shonalika, Shomya. Very good, beta. Pradeep, the good. Option A is the correct answer. Babita Tande. Very good. Option A is the correct answer. Bubu Behera, Girish Mahapatra. Option A only correct answer. Next question. Question number 399. Which of the following is the main symptoms indicating the presence of pulmonary hypertension? Which of the following is the main symptoms indicating the presence of pulmonary hypertension? Option A, flat neck veins. Option B, shortness of breath while resting. Option C, enlarged spleen. Option D, enlarged lungs. So which option is the correct answer? आंसर कर दो बेटा फटाफट, आंसर कर दियो फटाफट, आंसर कर दियो. So correct answer is beta option B is the correct answer. Option B is the correct answer. Shortness of breath while resting. Main symptoms indicating the presence of pulmonary hypertension, that is shortness of breath while resting, right? Option B is the correct answer. Next question, 400. Question 400. Option देची बेटा क्वेश्चंस कौन ballooning out of the chest wall. Ballooning out of the chest wall through an injured rib space is called. Option A intercostal retraction. Option B is substernal retraction. Option C is flail chest. Option D is pigeon chest. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर करो बेटा फटाफट. Ballooning out of the chest wall through an injured rib space is called intercostal retraction. Option B is substernal retraction. Option C is flail chest. Option D is pigeon chest. So which option is the correct answer? So correct answer is beta flail chest. Option C is the correct answer. Ballooning out of the chest wall through an injured rib space is called flail chest. Flail chest. Right? Option C is the correct answer. Next question. Question number 401. क्वेश्चन नंबर 401 बेटा भूल ले हो आंसर करो थोड़ी हमें एबे फाइनल एग्जाम दोची गलती ले हो बेटा गलती तो होगा अभी गलती करोगे तो बाद में गलती करना नहीं पड़ेगा राइट ठीक ठाक आंसर करो जोटा आसुची आंसर करो जोटा आसुनी आंसर भूल कर ले भी किसी असुविधा नहीं राइट क्वेश्चन नंबर 401 जोटा इजी क्वेश्चंस थिबो जाने सुने भूलभाल कले मुसी समय रागुची हैला तमनको ऊपर रागिबा सेटा होची भल पाइबा बेटा तमने केमती भलो करबो OSSSC नर्सिंग ऑफिसर एग्जाम्स के आगो केमती भलो करबो बहुत बड़ा एग्जाम्स आउ सी AIIMS एग्जाम सेंट्रल गवर्नमेंट स्टेट गवर्नमेंट अना नै इजी इजी क्वेश्चंस थिबो तमे जदी भल से न पढे के आंसर कर दो से समय मु रागुची अदरवाइज तमे बड़ पिला हेलणी तमनको कोन बाडे हेबो किछि कहि हेबो तमे माने स्टूडेंट रेस्पोंसिबल पर्सन्स अना नै मैंने तुम निजर फैमिली को एबे चलैब से पे हमको भल से पाठ पढ़िया पड़ो जमती OSSC नर्सिंग ऑफिसर्स एत गुड़े पोस्ट बाहर जमती आमर गोटे पोस्ट आमर हम जमती राइट सो क्वेश्चन नंबर 401 अच्छे ए हर्स shrill sounds heard during inspiration with laryngeal obstructions each option is crepitus option B is stridor option C is ronchi option D is wheezy so which option is the correct answer which option is the correct answer stridor stridor have a correct answer right stridor is a high pitched or harsh or shrill sound produced during inspirations and it is indicating in obstruction in the larynx or trachea obstructions in larynx obstruction in larynx or trachea hello a harsh shrill sound heard during inspiration with laryngeal obstructions कहले ना बेटा obstructions in larynx or trachea it is stridor option B is the correct answer very good next question number 402 which disease also known as peritonsillar abscess which disease is also known as peritonsillar abscess and commonly develops as a complication of tonsillitis very important MCQ beta very important MCQ which disease is also known as peritonsillar abscess and commonly develops as a complication of tonsillitis option D is mumps option B is Quinsy option C is cough option D is crop so which option is the correct answer so correct answer is beta Quinsy option B is the correct answer Quinsy is known as peritonsillar abscess Quinsy is known as peritonsillar abscess and this is commonly develops as a complication of tonsillitis so option B is the correct answer but option B is the correct answer next question option question number 403 which of the following respiratory patterns is characterized by prolonged inspirations arrest followed by inadequate expirations which of the following respiratory patterns is characterized by prolonged inspiration arrest followed by inadequate expirations option A is paradoxical respiration option B is cosmal respiration option C is apneustic respiration option D is chain Stokes respirations so which option is the correct answer beta which option is the correct answer फटाफट के आंसर कर दियो which of the following respiratory patterns is characterized by prolonged inspiration arrest followed by inadequate expirations so correct answer कौन हबो बेटा so correct answer हबो option C apneustic respirations so the respiratory pattern characterized by prolonged inspirations arrest followed by inadequate expiration is apneustic respiration so बेसी समय prolonged period or gasping inhalation a very short very short periods and this is ineffective to exhalation right so option C is the correct answer next question number 404 when recording blood pressure using sphygmomanometer when recording blood pressure using sphygmomanometer मन रखिछ ना बेटा ब्लड प्रेशर मेजरिंग recording को थरे करा होचे sphygmomanometer ए सब क्वेश्चंस भी पचारे बेटा बेले बेले ए सब भी भूल करबा नै so when recording blood pressure using sphygmomanometer the sounds which can be heard with a stethoscope placed over the artery is termed as the sounds which can be heard with the stethoscope placed over the artery is termed as option A रचे wheeze, option B रचे murmurs, option C रचे crackle sounds, option D रचे Korotkov sounds. When recording blood pressure using sphygmomanometer, the sounds which can be heard with the stethoscope placed over the artery is termed as option A wheeze sound, option B murmur sound, option C crackle sound, option D Korotkov sounds. So which option is the correct answer? But option D is the correct answer. Very good Pradeep Gold, Gitanjali Behera, Miku Lija, Girish Mahapatra, Satyabrata Raut, Shumya Panigrahi. Option D only correct answer, but option D is the correct answer, right? Very good. Next question number 405. A patient is considered as having multi-drug resistance TB if he has resistance to option A rifampicin, option D streptomycin, option B isoniazid, option B isoniazid and pyrazinamide, option C isoniazid and rifampicin, option D isoniazid and streptomycin. A patient is considered as having multi-drug resistance MDR TB. A patient is considered as having multi-drug resistance TB if he has resistance to option A rifampicin and streptomycin, option B isoniazid and pyrazinamide, option C isoniazid and rifampicin, option D isoniazid and streptomycin. So which option is the correct answer? So option C is the correct answer. Better isoniazid and rifampicin. Isoniazid and rifampicin, right? Option C is the correct answer. Very good, Sonalika, Girish Mahapatra. Hello. हाँ. Class कोचे live class रची पिलांग पढ़ो चिटी के. लगी वो उड़े आओ आधा घंटा घंटे टे. कौन पे? किए? ओहो हाँ ठीक अच्छे हाँ ठीक अच्छे ओके Okay. Next question number 406. The presence of air or gas in the pleural cavity is termed as option A pneumothorax, option B hemothorax, option C chylothorax, option D pyothorax. So which option is the correct answer? So correct answer is pneumothorax, right? Option A is the correct answer. Option A is the correct answer. Next question number 407. The valve of Rosen-Muller and valve of Hassner are located at the valve of Rosen-Muller and valve of Hassner are located at the option which is superior sagittal sinus, option which is interior of the uterine cavity, option which is external surface of the right ventricle, option which is nasolacrimal duct. So which option is the correct answer? Which option is the correct answer? Which option is the correct answer? So option D is the correct answer. But option D is the correct answer, right? Option D is the correct answer. The valve of Rosen-Muller and valve of Hassner are located at the nasolacrimal duct. Option D is the correct answer. Next question number 408. cough is also known as option is bronchopneumotracheitis, option is laryngotracheobronchitis, option C is laryngopharyngovestibulitis, option D is nasopharyngotonsillitis. So which option is the correct answer beta? Cough is also known as laryngotracheobronchitis. So option B is the correct answer. Option B is the correct answer, right? Option B is the correct answer beta. Cough is also known as laryngotracheobronchitis. Cough is also known as laryngotracheobronchitis, right? So option B is the correct answer, right? Next question. Question number 409. The appearance of black sputum usually indicates. Option which is staphylococcal pneumonia. Option which is pneumococcal pneumonia. Option which is co-workers pneumonia. Option which is mycoplasma pneumonia. So which option is the correct answer? Mycoplasma pneumonia, co-workers pneumonia, pneumococcal pneumonia, staphylococcal pneumonia. So which option is the correct answer? फटाफट आंसर कर दे बेटा, फटाफट आंसर कर दे. So correct answer is option C beta. Option C is the correct answer. Co-workers pneumonia. The appearance of black sputum usually indicates the co-workers pneumonia, right? So long-term inhalations of coal dust hele beta a co-workers pneumonia है boy, है ना? नहीं, long-term inhalation of coal dust. Long-term inhalation of coal dust causes co-workers pneumonia or appearance of black sputum, right? Black sputum दिसिबा हमको बेटा, right? वो केस रे co-workers pneumonia केस रे केते बेले ई co-workers pneumonia होची जदि long term inhalation of coal dust हबो बेटा, जो माने कोयला खणी किंबा कोयला फैक्ट्री रे काम करते हैं से मानकु co-workers pneumonia हेता है बेटा, right? Next question, question number 410. The breathlessness that occurs in the upright position and is relieved with recumbency is option which is orthopnea, option which is hyperpnea, and option C which is treponia, and option which is platinea. So which option is the correct answer beta? The breathlessness that occurs in the upright position and is relieved with recumbency. Recumbency positions means beta upright positions. No. So which option sab beta? Which option is the correct answer? So shortness of breath that occurs in the upright position and is relieved by recumbency means beta lying down position. Recumbency means lying down positions, right? Upright positions रे breathlessness हबो एवं lying down हेले कौन हबा relieved हे जीवा. तो को केस रे हुए बेटा platypnea हबो बेटा, platypnea हबा correct answer, right? Option D is the correct answer. So orthopnea कौन बेटा? Orthopnea is it is relieved by sitting or standing. Relieved by sitting or standing. And shortness, breathlessness occurs when lying down. Breathlessness occurs when lying down. है ना, that is orthopnea. Hyperpnea कौन बेटा? Increase in the volume of air taken during breathing, है ना, that is hyperpnea. And trypopnea कौन बेटा? Trypopnea, shortness of breath occurs when the patient in supine position, right? Trypopnea कौन? Breath, shortness of breath that occurs when the patient in supine positions, right? Okay, correct answer कौन होगा? Option D is the correct answer, right? Breathlessness that occurs in the upright position and is relieved with recumbency or lying down, that is platypnea, right? Option D is the correct answer. Next question, question number 411. Chief and common cause of pulmonary embolism is? Option A is fat emboli, option B is air emboli, option C is septic emboli, option D is venous thrombosis. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दे बेटा. Which option is the correct answer beta? So correct answer is option D. Option D is the correct answer. Chief and common cause of pulmonary embolism is venous thrombosis. Venous thrombosis. Option D is the correct answer. Very good. Next question, question number 412. Destruction of the wall of the alveoli. Destruction of the wall of the alveoli. Most important MCQ. Atelectasis, option B. Option A is atelectasis, option B is asthma, option C is emphysema, option D is bronchiectasis. So which option is the correct answer beta? So correct answer is emphysema. Destruction of the wall of the alveoli is called emphysema. Right? Option C is the correct answer. Option C is the correct answer. Next question, question number 413. When ventilation exceeds perfusion, it leads to which of the following? Option A is dead space, option B is silent unit, option C is pneumothorax, option D is shunt. So which option is the correct answer? Correct answer is dead space. When ventilation exceeds perfusion, it leads to which of the following? Dead space. Dead space. This is the long volume, that is the ventilated but not perfused. Lungs ventilated but not perfused. It means does not participate in gas exchange. Does not participate in gas exchange. In gas exchange. Gas exchange ही पारो नहीं बेटा. Right? Next question, question number 414. In which of the following clinical condition high flow oxygen cannot be given? In which of the following clinical condition high flow oxygen cannot be given? Very very important बेटा. को केस रे हमें high flow oxygen cannot be given दे पारिबा नहीं. Which clinical condition high flow oxygen cannot be given? Very very important. Option A is pneumonia, option B is asthma, option C is TOF, option D is ARDS. Answer कर दे बेटा. TOF. TOF हबो ना ARDS हबो ना asthma हबो ना pneumonia. So correct answer is TOF. Tetralogy of Fallot. Tetralogy of Fallot. Tetralogy of Fallot. है ना? TOF. Option C is the correct answer. Next question. Question number 415 अच्छी बेटा. The patient develops type 2 respiratory failure, which is a probable cause of this. Option A is interstitial lung disease, option B is flail chest, option C is pulmonary edema, option D is ARDS. So which option is the correct answer? Which option is the correct answer बेटा? फटाफट आंसर कर दे बेटा. फटाफट आंसर कर दे. So correct answer is option B बेटा. Flail chest. Flail chest is the correct answer. Type 2 respiratory failure is a condition where there is too much carbon dioxide, and not enough oxygen in the blood. Too much CO2 and less or decreased amount of O2 in the blood, increased CO2 and decreased amount of O2 in the blood. Option V is the correct answer beta. एमती कंडीशन कौन कह जाए बेटा हाइपर कैप्निया कह जाए बेटा हाइपर कैप्निया कहते ए कंडीशन को मैक्सिमम कार्बन डाइऑक्साइड एक्युमुलेशंस हबो अन नै ताहले हमें कौन कहबा हाइपर कैप्निया कहबा so correct option B have beta phlealgist. Next question number 416. In COPD patients secondary polycythemia may develop due to option A thrombosis condition, option B bleeding, option C thrombocytopenia, option D neutropenia. So which option is the correct answer? The correct answer is thrombosis condition. Option A is the correct answer. Next question number 417. Cosmal breathing is a deep and labored breathing pattern often associated with option A diabetic ketoacidosis, option B hepatitis, option C hepatomegaly, option D acute renal failure. So which option is the correct answer beta? So correct answer is diabetic ketoacidosis. Cosmal breathing is a distinct pattern of deep and labored breathing and it is classical sign of severe metabolic acidosis like DKA, diabetic ketoacidosis, right? Option A is the correct answer beta. Option A is the correct answer. Next question number 418. The correct angle for head of the bed. The correct angle for head of the bed elevation in ventilated patients to decrease respiratory complications. Very important MCQ. Very important MCQ. Between 20 to 30 degrees. Option B between 30 to 45 degrees. Option C between 45 to 60 degrees. Option D 90 degrees. So which option is the correct answer? Which option is the correct answer beta? फटाफट आंसर कर दो, फटाफट आंसर कर दो. सो करेक्ट आंसर इज ऑप्शन बी between 30 to 45 degree head of the bed elevation in ventilated patient to decrease respiratory complications. Between 30 to 45 degree of angle for head of the bed elevation in ventilated patient to decrease respiratory complications. 30 to 45 degree, right? Next question number 419. When the patients develop dyspnea, what is the first intervention that is to be carried out? When the patients develop dyspnea, what is the first intervention that is to be carried out? Option A take blood pressure, option B elevate the foot of the bed, option C remove pillows from the head, option D elevate the head of the bed. So which option is the correct answer? Answer karo beta. When the patient develop dyspnea, what is the first intervention that is to be carried out? Answer karo फटाफट. कौन करो बेटा? आंसर करो फटाफट, आंसर कर दियो. पेशेंट को डिस्निया डेवलप होची तो हमें कौन इंटरवेन करबा पेशेंट पे? एलिवेट द हेड ऑफ द बेड हो बेटा. ऑप्शन डी इज द करेक्ट आंसर. आखी मुझे के आंसर करो बेटा. ऑप्शन डी वेरी गुड. गिरीश महापात्र, सोनालिका, देवव्रत राउत, बबीता तांडे. ऑप्शन डी एलिवेट द हेड ऑफ द बेड. फर्स्ट इंटरवेंशंस फॉर द पेशेंट्स. Next question number 420. Which condition sees in iron deficiency anemia? Which condition sees in iron deficiency anemia? Option A decreased breathing and increased activity. Option B increased breathing and increased activity. Option C decreased breathing and decreased activity. Option D increased breathing and decreased activity. So which option is the correct answer? Which option is the correct answer beta? So correct answer is beta. Option D is the correct answer. Option D is the correct answer. Increased breathing and decrease activity. Option D is the correct answer. Which condition is in iron deficiency anemia? Increase breathing and decrease activity. Option D is the correct answer. Next question number 421. DOTS is used in the treatment of. DOTS is used in the treatment of. Very important MCQ. Very important MCQ. Easy MCQ but एटा भी पिला भूल करते. DOTS रो full form कौन है बेटा? direct observed treatment short course. Treatment short course. DOTS full form आसुची बेटा. full form भी पचारुची बेले है direct observed treatment short course. DOTS is used in the treatment of tuberculosis. Option B leprosy, option C malaria, option D filaria. Option A हवा, B हवा, C हवा, D हवा. So correct answer is malaria. Sorry, Tuberculosis. So correct answer is tuberculosis, right? Dots is used in the treatment of tuberculosis, right? Sorry beta. Dots is used in the treatment of tuberculosis, right? Tuberculosis, right? 5 drugs under dots. Okay. Next question, question number 422. Which of the following is the earliest manifestation of inadequate oxygenations? Which of the following is the earliest manifestation of inadequate oxygenations? Option A is vomiting, option B is bradycardia, option C is restlessness, option D is hypotension. So which option is the correct answer, beta? Which of the following is the earliest manifestation of inadequate oxygenations? So correct answer is restlessness. Restlessness is one of the first sign of hypoxia or inadequate oxygenations. Inadequate oxygenations or hypoxia. Right? Next question, question number 423. A clinical sign of impending death is option is increased movements of extremities, option is increased muscle tone, option is O-ring, option D is chain stokes respirations. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दे बेटा. Clinical sign of impending death is option is increased movement of extremities, option B is increased muscle tone, option C is O-ring, option D is chain stokes respiration. So which option is the correct answer? Which option is the correct answer? The correct answer is option D. Option D. Very good. Babita Tande, Devrat Rao, Sonalika, Jakinshni Tande. Clinical sign of impending death is chain stokes respiration. Chain stokes respirations. Right? Next question, question number 424. What is the full form of COVID-19? What is the full form of COVID-19? फटाफट आंसर करो बेटा. Option A कोरोना वायरस डिजीज 2019, ऑप्शन बी कोरोना वायरस डेफिशिएंसी 2019, ऑप्शन सी कोरोना वायरस डिजीज, ऑप्शन डी कोरोना वायरस डिजीज 2021. बेटा जतिक जण देखुछ ना समस्त कमेंट करो कोरोना कोविड-19 रो करेक्ट आंसर कोन हबो फुल फॉर्म फटाफट आंसर करो बेटा फटाफट आंसर कर दियो समस्त आंसर करो बेटा आंसर करो फटाफट आंसर करो बेटे सो करेक्ट आंसर इज ऑप्शन ए कोरोना वायरस डिजीज 2019 and this is caused by SARS-CoV-2 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 virus. Right, next question. 425 continuous babbling in water till chest drainage is considered. Option A normal finding, option B surgical emphysema, option C air leakage in system, option D chest drain in out. बट ये क्वेश्चन आम डिस्कसन कर सारी है आम को जना थी सो करेक्ट आंसर इज ऑप्शन सी. Option C is the correct answer, right? Next question, question number 426. Bagasosis is due to inhalation of very important MCQ, 5-star MCQ. Bagasosis is due to inhalation of option A silica dust, option B cotton dust, option C sugar cane dust, option D coal dust. So which option is the correct answer? फटाफट आंसर कर दे बेटा फटाफट आंसर करो. So correct answer is sugar cane dust. Bagasosis is due to inhalation of sugar cane dust. Right, option C is the correct answer. Option C is the correct answer. Next question, question number 427. A heliox is mixtures of option A is helium plus oxygen, option B is helium plus CO2, option C is helium plus hydrogen, option D is helium plus nitrogen. Which option is the correct answer बेटा? फटाफट आंसर कर दिया, फटाफट आंसर करो बेटा. Heliox is mixture of which option is the correct answer? So correct answer is beta helium plus oxygen. Option A is the correct answer. Next question, question number 428. Which client should taken on priority? Option which client of third day of post myocardial infarctions. Option which post of 24-hour post operative after appendicitis. Option A patient of third day of post MI post myocardial infarctions. Option B is patient of 24 hours post operative after appendicitis. Option C is difficulty with breathing after road traffic accident. Option D is all of the above. So which option is the correct answer? Which clients should take on priority? कहाँ को हमें priority basis रे नवा को patient so correct answer is beta difficulty with breathing after RTA. So correct answer is option C है beta. Option C is the correct answer. Option C, very good. Option C is the correct answer. Next question, question number 429. Spraying kerosene on stagnant water. Spraying kerosene on stagnant water shall kill Anopheles due to. Option A, prevention of spiracle to come in contact with air. Option B, entry into a and blocking of respiratory tract. Option C, diffusion into body. Option D, burning of body wall. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दे बेटा. Spraying kerosene on stagnant water shall kill Anopheles due to entry into and blocking of respiratory tract. Option B is the correct answer. Next question, question number 430. Which is the best interventions for a patient with tension pneumothorax? Option A is chest tube insertion in second intercostal space at mid clavicular space line. Option B is insert the needle 6 to 7 intercostal space, then insert tube. Option C is insert the needle 8 to 9 intercostal space, then insert tube at mid clavicular space line. Option D is no need any intervention. So which option is the correct answer beta? So correct answer is option A. Best intervention for patient with tension pneumothorax, that is chest tube insertion in second intercostal space at mid clavicular space line. Option A is the correct answer. Next question, question number 431. Which occupational disease is called anthracosis? Which occupational disease is called anthracosis? Option A is silica dust. Option B is asbestosis. Option C is cotton dust. Option D is coal dust. So which option is the correct answer? Which option is the correct answer? Which option is the correct answer? Anthracosis, also known as black lung disease. Anthracosis is also known as black lung disease. Black lung disease. Black lung disease को कहते बेटा anthracosis को. So which option is the correct answer बेटा? Which option is the correct answer? So correct answer is बेटा coal dust हवा, हाँ ना नहीं, coal dust हवा. Very good, coal dust. सौम्या पाणिग्राही, बबीता तांडी, सोनालिका. Very good. Option D is the correct answer. Next question, question number 432. Question number 432. In COPD patient, aminophylline has given the mode of action of these drugs. In COPD patient, aminophylline has given the mode of action of this drug. Option A is bronchodilator. Option B is anticholinergic. Option C is mucolytic. Option D is antitussive. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option A, bronchodilator. COPD patient, aminophylline has given the mode of action of this drug. This is bronchodilator. Aminophylline is a bronchodilator. Aminophylline is a bronchodilator. Next question, question number 433. Rails are most commonly associated with. Rails are most commonly associated with. Option A is pulmonary hypertension. Option B is pulmonary edema. Option C is emphysema. Option D is asthma. So which option is the correct answer? Rails, also known as crackles. Rails, also known as crackles. Crackles sound beta. Rail sound is otherwise known as crackle sounds, and this is abnormal sound beta. Abnormal sound, crackle sound or rail sounds or abnormal sounds is typically associated with presence of fluid in the lungs, presence of fluid in the lungs हेले crackle sound किंबा रेल sound हमको देखिबा को मिलिबो. So which option is the correct answer? So correct answer is बेटा pulmonary edema हबो, pulmonary edema. So pulmonary edema रे कौन हुए बेटा accumulation of fluid in the lungs हबो बेटा, accumulation of fluid in the lungs, accumulations of fluid in the lungs हे गले pulmonary edema है जो बेटा accumulation of fluid in the lungs बेटा, in the lungs से पे fluid overload हेले बेटा pulmonary edema हुई. over बेसी फ्लुइड जेतिकी दरकार पेशेंट रिक्वायरमेंट बाहर जदि एक्सेसिव फ्लुइड कर देले ताहेले पेशेंट को पल्मोनरी एडिमा हबो, पेशेंट डेथ हबो, पेशेंट पे लाइफ थ्रेटनिंग कंडीशंस हे जबो बेटा. नेक्स्ट क्वेश्चन नंबर 434. Which bacterial toxins kills healthy tissue of the respiratory system and forms a gray coating pseudomembrane? Option A is Mycobacterium tuberculosis, option B is Helicobacter pylori, option C is Vibrio cholera, option D is Corynebacterium diphtheria. So which option is the correct answer? Which option is the correct answer? So correct answer is beta option D is the correct answer. So diphtheria toxins produced by Corynebacterium diphtheria. So diphtheria toxins produced by Corynebacterium diphtheria, right? Option D is the correct answer. Option D is the correct answer. Beta. Next question number 435. In ribs fracture, which type of respiration pattern seen in patient during respiration? Very important MCQ beta. Very important MCQ. Mone rakhi tha. Option रचे pain during inspiration. Option B रचे deep and rapid respiration. Option C रचे paradoxical respiration. Option रचे pain while expiration. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया बेटा. So correct answer is option C, paradoxical respirations. Paradoxical respirations. In patient with rib fracture, the type of respiration pattern most significant, most specifically seen in especially paradoxical respirations beta. Option C is the correct answer, right? Very good, Babita Tandi. Next question number 436. Which is the confirmatory test of TB? Very important. Which is the confirmatory test of TB? Option A sputum culture, option B chest X-ray, option C Mantoux test, option D PFT, pulmonary function test. PFT, pulmonary function test. Pulmonary function test. So which option is the correct answer beta? Which option is the correct answer? Which option is the confirmatory test of for tuberculosis? Which option is the correct answer? Very good. Option A is the correct answer. Very good, very good. Option A is the correct answer. Sputum culture. Sputum culture is the confirmatory test for TB patients. The next question number 437. In a patient, tongue and epiglottis are protrude inside the mouth, then what findings are seen in the patient? Option A ronchi, option B stridor, option C wheezing, option D gurgle sound. So which option is the correct answer beta? So correct answer is option B is the correct answer beta. Option B is the correct answer. Stridor habo correct answer beta. Next question number 438 achi beta. A patient with tension pneumothorax, tension pneumothorax comes in emergency department. In that condition, needle insertion can be done at option A. Very important beta. Option देखिबा तापरे first मैं तुमको कहि दोछि, this is first 5-star MCQ. Option A second ICS, second intercostal space, second intercostal space at mid clavicular line. Option B रचे second intercostal space at anterior axilla. Option C रचे second intercostal space at mid clavicular. Option D रचे second intercostal space at anterior axilla. So which option is the correct answer beta? So which option is the correct answer? Very good. Devabrata Raut, Sonalika, Jyoti Manjiri, Jyoti Pradipta Goda, Pavita Tande, Somya Panigrahi. Option A is the correct answer. In a patient with tension pneumothorax in the emergency department, needle insertion for decompression is recommended at the second intercostal space at mid-clavicular line. Option A is the correct answer. But next question number 439. Patient with anterior medullary brain injury has deep, irregular and hypoventilation with apnea. Which type of respirations? Patient with anterior medullary brain injury has deep, irregular and hypoventilation with apnea. Which type of respiration? This is which type of respiration? Option A biot respirations, option B is cosmal respiration, option C is chain stroke respiration, option D is apnea. So which option is the correct answer, beta? So which option is the correct answer? So correct answer is beta biot respiration. Option A is the correct answer. Biot respirations, also known as beta ataxic respiration. Ataxic man rakhe to beta. Biot respiration is otherwise known as ataxic breathing. Ataxic breathing or cluster respiration. Now कौन कहते बेटा? और cluster respiration कहते. Cluster respirations, right? So option A is the correct answer. This is the abnormal pattern and irregular depth and rate of medulla brain injury patients. Anterior medulla brain injury patients has deep, irregular and hypoventilation with apnea. This is a type of bites respirations, right? Next question number 440. In COPD patient, there is a compensatory polycythemia developed in patients. Most important priority in this patient is option A is ineffective breathing pattern, option B is congestion developed due to thrombosis formation, option C is ineffective nutritional pattern, option D is no one. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is beta option B, congestion developed due to thrombosis formations. Congestion developed due to thrombosis formation. In COPD patients with compensatory polycythemia often develops, leading to an increased red blood cell count, right? And this is increase in red blood cells makes blood thicker and increase the risk of blood clot formation, thrombosis. And this is the formation of blood clot formations can leads to complications like thromboembolism or deep vein thrombosis, right? Deep vein thrombosis. So option B is the correct answer, beta. Option B is the correct answer, beta. Thank you so much, beta. एतिकी क्लासेस करिबा बेटा. गुडे अर्जेंट काम अछि बेटा. मते कॉल आइतले सेही पई मु आधा घंटा पर आउछि बोली कहितली. अर्जेंट काम अछि, जनकर देह असुस्थ हेछि, हॉस्पिटल नै कि जाइछन, मु जाउछि. हला हॉस्पिटल जिवा पड़िबो. ओके, थैंक यू सो मच बेटा जो माने जिगर लाइव क्लासेस रे जोड़ी हेतिबारु. ओके, आसंता काली पुणी पढ़ा बेटा संध्या समय, राइट? एबे बसिकी पढ़, नले कुआडे बुलवाई जदि जीवार अच्छी जाओ, बुल, आस, पुणी आसिकी बही खाता बाहर करके पाठ पढ़ संध्या, राइट? ट्राई करुली बेटा आउरी क्वेश्चन आंसर आम देखी था, बट इश्यू होती गोटे कलिग्स लैब टेक्नीशियंस भाई जनकर सिस्टर देह खराब, से हॉस्पिटल जावाक पड़ो. कॉल करते भाई मैंने समस्त असुविधा समय हमको हेल्प हबार अच्छे ना बेटा, से जावाक पड़ो. तो मु क्लास कंटिन्यू करि पारुनी बेटा, ना बहुत गुड़े MCQ मु रेडी करथिले तुम मानक किसी असुविधा नहीं बेटा. नेक्स्ट क्लास में पढ़ा, फिर भी हमें बहुत गुड़े क्वेश्चंस कवर अप कर सारी, राइट ना? सो ऑल द बेस्ट बेटा. स्टे मोटिवेटेड एंड तमरो प्रिपरेशन कंटिन्यू रहू बेटा. प्रिपरेशन रे किसी ये हबार नहीं बेटा, बाधा सृष्टि हबार नहीं. निहाती भाव आम डेली पढ़ा, जी आम टार्गेट अच्छी से टार्गेट को अचीव करवा एग्जामिनेशन पूर्व निहाती भाव क्रैक करवा. यही वर्ष जो 5989 नर्सिंग ऑफिसर्स वैकेंसी को, राइट? निहाती भाव गोटे सीट. नेक्स्ट क्लास डिस्कस अबाउट मस्कुलोस्केलेटल सिस्टम. ओके बेटा, ठीक अच्छे. ओके बेटा, ये सेशन को एंड करवा. जो मैंने व्हाट्सएप ग्रुप रे जोड़ी ही ना रिक्वेस्ट पठेदेवा बेटा, मुझे एक्सेप्ट करदेवी. व्हाट्सएप ग्रुप रा लिंक दे दिया है, राइट? सो व्हाट्सएप ग्रुप रे जोड़ी ही जीवो, मु लिंक आउ थे शेयर कर दूची बेटा, राइट? जो मैंने भी व्हाट्सएप ग्रुप रे जोड़ी हो जीवो सेथिरे भी किछि किछि इंपोर्टेंट अपडेट मु तुम मानको शेयर करेबी हैला निजर प्रॉब्लम्स भी शेयर करि परिबो एनी डाउट एनी प्रॉब्लम्स राइट मु शेयर कर दी लिंक ओके लिंक चैट रे अछि बेटा लिंक देखि दियो एबे आसी जैतिबा देखो चैट बॉक्स रे अछि बेटा मु लिंक शेयर कर देछि देखि दे ज्वाइन कर दे ओके ओके बाय टेक केयर बेटा टाटा।